Yeah, just trying to utilize the time in the best interest of our people. This is Jengjal Subdivisional Hospital, and we are privileged that this hospital is here. Now, it is usual for people to have that uh, associated aspiration whenever any new initiatives are embarked upon, and it is quite I must say, I'm happy to see that at least people have started coming to the hospitals. It was very difficult to convince people to come to hospital for medical checkup and have access to our healthcare facilities. I am revisiting my own experience as a medical and health officer when I was posted in Zigzag Public Health Center. And it was very difficult for us to convince people to bring their children, to bring the pregnant mothers for antenatal checkup, to bring the pregnant women for institutional delivery. It has been always difficult. That's why you have seen, as government, we embarked upon a number of initiatives to incentivize institutional delivery in order to bring down the maternal mortality rate, infant mortality rate, because these are the indicators which were bringing down our human development index for the purpose of positioning ourselves as a developed nation. You have to take care of your HDI. So it is good that today we see mothers bringing their children for pediatric checkup and also mothers coming for antenatal checkup. There's a concern here because the facilities are not adequate. It is a subdivisional hospital. So the facility is something which should commensurate for a hospital which is designated as subdivisional hospital. That's why I have come here. This is something which has to be intervened from the side of the government. I'll be taking up, and at the same time, this particular hospital has to be also looked at from the logistic perspective. In view of the number of incidents of road accidents, you have the National Highway 51 here, and you have the National Highway 127B merging here at Jengjal. And the incidence of road accidents has drawn the attention of all of us. In fact, I have reviewed as to how the district road safety committees are functioning. Are we pulling up our shocks to ensure that we minimize the incidence of road safety, and also to ensure that people who are victim of road accidents, as far as possible, we minimize the loss of precious life. Now, therefore, all these facilities must be made available, in particularly in Jengjal. We have talked about this earlier also, and we are taking it up at the district road safety committee. I'll be taking it up with the state road safety committee. State road safety committee, the chairman is the minister himself. So I think there's plenty of space which is available for us to do and improve, and at the same time take it as a privilege to respond to the need of the people, because funds are available for this. In as far as the trauma center is concerned, we have had the privilege of getting fund for Tura Trauma Center. That is not completed yet. I have had a review recently. Because in the trauma center, the burn unit which was supposed to be there has not been established. The intensive care unit which is there, 6-bedded, that's not operational. So therefore, the fund notwithstanding being available, how we best utilize them in view of the number of precious lives that we are losing. And then issue of ambulance. Ambulances must be equipped with life support system. Basic life support, advanced life support. You have seen how many preventable deaths we have seen during the time of pandemic. So these are lessons which we have learned. Therefore, I think we should be in a better position to understand the areas of deficiency and do what is necessary to bridge the gap.
So you also mentioned the problems being faced by children in terms of getting certificates.
Birth certificate.
Yes,
Now you see, birth certificate. This Jengdal Subdivisional Hospital is being run on PPP mode. So the delegation of power, as per the mandate of law, uh, is with the government doctors. So it is desired that one doctor is designated here to come on a designated day in a week. We are taking it up. I think the district administration will take a call, because many of our children who were born, who were not privileged to be somehow born in the hospital, or are not product of institutional delivery, they don't have their birth certificate issued at the time of birth. So what happens? When they pass metric, when they need the birth certificate to get further admission for higher education, then they come to hospital for birth certificate. So these are areas of concern where there's a gap, and keeping in mind the constraints expressed by the affected children, affected students, we have discussed this. I think this will be corrected. So this is not a problem only here. This problem is there in East Garo Hills, in North Garo Hills, in Southwest Garo Hills, everywhere. So we are taking it up, and then we will see that all the authorities concerned who are vested with this responsibility fulfill their responsibility in the right earnest.